Focus on something really important as we close our program out. As Breast Cancer Awareness Month shines a light on the millions of women affected, it's important to address not only the medical journey that people embark on, but also the skin-related challenges that women face when they undergo things like immunotherapy, radiation treatment, as well as mastectomies. These medical and chemical interventions strike at the core of womanhood. We've seen it in our communities. It affects people's self-esteem. So this morning we want to focus on the healing journey of cancer patients and solutions to combat some side effects. And biomedical scientist who specializes in acute, chronic and post-surgical wound healing and regenerative medicine and cell therapy, Dr. Judey Pretorius joins me now. That certainly was a mouthful there. Judey, thank you so much for being with us. Often when we talk about cancer, so we talk about a range of different interventions and treatments. We don't really focus as much on the impact on things like our skin or even on wound care post those surgeries. So just share with us this morning how important an arena of focus this really needs to be.
So I think I would like to start by saying the human skin likes to tell a story. It's a very audible organ. And what do I mean by that? The human skin tells you what type of emotions you and I are having. If we are happy, you know, there's a bit of a glow. If we're anxious, we can have a bit of a sensitivity, etc. Now we can even take it a little bit further by saying, but what if we have to drink certain medication? How is our skin going to respond? And what if we go through certain severe treatment modalities, for instance, like cancer? How exactly is our skin going to respond? Now, the first thing, if I can break it down, chemotherapy, for one. Some of the chemotherapy that we know is the red devil. And if that is flushed through your system to actually, you know, kill all sorts of cancerous cells, it's a bit of a toxin, and there's a side effect called skin toxicity. And these patients start to experience things like severe sensitivity, severe scaliness of the skin, severe irritability toward things in the environment and so forth. We take it further than that. There's radiation, where radiation also focuses on very particular cancer cells where individuals actually get something like a superficial burn wound on their skin. Aside from that, there's the surgical scars as well, the mastectomies and the lymphectomies and so forth. And the concern is that after these type of treatments, because your immune system is so compromised, your healing process is also inhibited. And what you would like to overcome is to make 100% sure that a patient don't really struggle with the scars like a keloid or a hypertrophic scar. So you want to expose them to things like products and very better treatment modalities to prevent all of that at the end of the day.
So there's two things, and I'll get to it in just a moment, but as you describe the impact of the skin, and as you say, the skin is almost like that inner cartographer. It tells us what's happening. I thought that was really beautiful. But it is intensive, it is invasive, and the side effects are really quite extreme, as you say. You're talking about preventative treatment as well as post-operative or dealing with the side effect treatments. What do those two worlds encompass?
Well, I would say the first thing, and for all our patients that's listening and watching the show this morning, the first thing that you should do is try to avoid any skincare products or any topical products that you can apply on the skin that contains a fragrance. So the moment you can smell that it really has a pleasant odor, avoid these type of ingredients. Avoid ingredients that typically you and I would like to use for advanced anti-aging. Avoid those.
Why are you including me now? Why do you have to make it personal, Judey?
Well,
just joking.
You are over 20, right?
Love that for us.
But intense anti-aging treatments like retinol and high concentrations of vitamin C and so forth.
Hyaluronic acid?
Hyaluronic acid is a good one for cancer, and I'll explain why. But the intense anti-aging treatments and ingredients we can avoid, fragrances, avoid. But hyaluronic acid, like you've mentioned, is a molecule that likes to draw water from the atmosphere, and even tenfold more than what our skin naturally produces. And one of the side effects that cancer patients experience, and they'll tell you, oh, I struggle with severely dry skin. It feels dehydrated. So go and get a product that you see in the ingredient list. It says hyaluronic acid. These ingredients for sure you can use. Ingredients like peptides and growth factors, even vitamin B3, we call it niacinamide, it's very popular in skincare products, are ingredients that you can put on. But on the flip side, I have to share something else with you. Some cancer patients, especially in the public sector, struggle with what we call fungating wound or ulcerating wounds. And these wounds are because they don't get the help when they need it and how they need it. They're on a waiting list for chemotherapy. Then these wounds start to tear through the skin and they ulcerate through the skin and they spread. And because of the fact that the immunity of that patient is so low, they get infection. And what we like to do is just give them products, products that's fairly inexpensive, like medicinal honey, again, hyaluronic acid, zinc, and so forth, that they can apply, close the wound, and then basically treat themselves at home just to make sure that wound turns around and that that is not the reason why they succumb to cancer.
When we talked about, all of the anti-aging stuff and some of the enzymes or compounds that are in them that can be helpful to people, I was thinking about the cost, because, there's a lot of money attached to those. And you talked about honey now as one of those, or medicinal honey as one of those easy to reach. What are other things that are easily and perhaps more cheaply available to people who are dealing with some of the conditions we're talking about? Well,
the first thing I'd like to say, the human species, if they have a wound, want to clean that wound every single day. So the first most inexpensive thing is don't clean your wound every single day. Our skin and even our bodies has protease, enzymes, etc. that wants to heal naturally. So we just have to facilitate the process a little bit by getting some of these ingredients. And I'm not saying go buy honey at the shop. There are things that you can do or look out for particular wound care products that are inexpensive, that contain honey, that you apply. And something very simple, like a paraffin gauze. In other words, it's an impregnated gauze with petroleum jelly that you can apply on top and a normal bandage over that and keep the wound closed for 3 days before you touch it. Stay away from, long showers, rather bathe in a shallow bath and so forth, but keep the wound closed for at least 3 days. And when you open it up, you'll see, but this wound is starting to proliferate, cell division is starting to take place. You will get a turn in that wound, I promise you.
Wow, and that's really sobering to hear that the body does want to automatically regenerate. I'm thinking about when you get a cut and you get a scab over that. Our inclination is to tear off that scab. But I've noticed that when I've let it go until the scab naturally falls off, that wound is beautiful.
Absolutely. Don't touch a wound. And like you mentioned with scabs, for instance, if we tamper on a scab, then we're going to get either hyperpigmentation or hypopigmentation. And basically what that means is if you fiddle a little bit, then you're going to get a mark there that's either darker brown or fair in color. So the complexion, there's going to be a very prominent complexion indifference.
So what are some of the things that people can do to prevent or deal or mitigate the risks of advanced tissue damage and promote tissue regeneration?
The first thing is look at your skin from the inside and the outside. Very important. If I say the inside, we know for a fact these collagen drinks that you find these days are important. It's not just good for your hair and your nails and so forth, but it's also very good for your skin, your bone, of course. So very, very good for your skin. Even better if you can find a type of collagen drink that does not necessarily just contain the collagen, but it contains all the ingredients, supplements, vitamins and minerals that you need for the day, and even better to that, a probiotic for the gut. So then you focus on your skin systemically. Then from a topical point of view, go and have a look at products and ingredients that you can apply twice a day, not once a day, twice a day, in the morning and the evening. Vitamin E, like our grandmas love vitamin E. Vitamin E, hyaluronic acid, peptides, growth factors, niacinamides, and all these ingredients that I just mentioned are over-the-counter type of products. You don't need a script for it. You can get it easily, you can buy it online, and just apply it twice a day.
When it comes to collagen, I mean, I'm thinking of things when we grew up eating, like, you know, cow's hooves and things like that, trotters and all of those sorts of things. I mean, could we make a bone broth? I mean, what can we do in our houses? Can we go to the store and say, give me a sack of bones and I'll go home and I'll boil those down?
Yes, absolutely. I think, you know, taking it further, we want to make 100% sure the Department of Environmental Affairs like to know, listen, what's the sources of where those animals come from, and what's the quality of the collagen and so forth there.
Oh.
So at least now, if you find a certain product that contains collagen, have a look at whether it's coming from a reputable source. Is the company registered at a statutory authority such SAPRA and so forth? And buy that product, because they will have looked at all the different peptides and amino acids in there and make 100% sure that the quality and the quantity is of an absolute efficacious nature.
We didn't have time to talk about it, but maybe your closing thought can be that while we focus on the physical, and you've given us some really amazing tips this morning, we often neglect that there's a psychological impact to all of this. When you have your breasts removed, when you have a mastectomy, or when you're dealing with things that people can visibly see, there's a huge psychological cost that comes with that.
Absolutely, and what I would like to end off, the human skin is a very public organ. So whether I have a little pimple today or whether I have a scar, it's going to have a direct impact on my self-esteem. So what I would like to do, my job, is to make sure that the human skin, we provide ingredients that the human skin want. Correct pH, correct ingredients at the right concentration, and the right application at the right time and day. And then it will help with the overall self-esteem.
Yeah, and really we must spare a thought for all of the people in general who are dealing with the aftermath of cancer, and also women who are losing, you know, what often people say is what defines you as a woman. We know that we're more than our breasts.
Yes.
We're more than all of that. So just strength and comfort to those, and I'm sure people are going to use the tips you've shared with us. Judey, it's been such a pleasure talking to you. Thank you for stopping by this morning. Biomedical scientist Dr Judey Pretorius, just sharing with us some really, really important advice when we're dealing with wound care and tissue regeneration.